And joining us now for a quick reaction is former CDC Chief Medical Officer Dr. Deborah Howry. She resigned after the White House ousted the CDC director while citing growing political interference in the agency's work. Dr. Howry, thank you. You've been watching along with me here. What are your top takeaways?
So many takeaways. You know, I agree with Senator Cassidy around the life-saving work that was done under the Trump administration for the COVID vaccine, and it's really disappointing that the secretary doesn't understand that supporting lawyers against vaccines is a conflict of interest as he's looking at putting people like that on the vaccine committee, the ACIP. I also thought that, Bennett had some really good points around transparency and data. We have been trying to do that at CDC and want to post data in advance of the ACIP meeting. And in fact, the secretary had taken down data around thimerosal at the last ACIP meeting. And then when he was talking about chronic disease, it struck me that, the majority of the chronic disease center is being wiped out in the president's budget, and what he is moving to AHA would focus on services and not much on prevention. And we have shown that for every dollar spent on tobacco prevention, we save $55 with our programs. So there is significant investment that's being done, and this is being done on local and states as well. Our funding, 80% goes out the door. And I guess the last thing I just wanted to say is I appreciate he acknowledged the sacrifice Officer Rose did for CDC staff and for our community, but I wish he had also acknowledged the trauma that CDC staff faced while covering their children in the daycare parking lot and being shot at in buildings. That was a violent attack on CDC, and I would think the secretary should acknowledge that trauma to our staff as well.
Well, and that attack is believed to be stemmed from misinformation related to COVID vaccines. And he got lots of questions in just that short amount of time, particularly from Senator Bennett and Senator Warner there about the COVID vaccine. He could not answer the question about how many Americans died from COVID or how many Americans may have been saved because of the vaccine. What did you make of that?
I had offered to brief the secretary, as had Dr. Jernigan and Dr. Daskalakis, on things like COVID, on H5N1, on flu, on measles. But the secretary never had a briefing from the senior leaders at CDC on any of these topics. If he had, he may know the answers to those questions.
In fact, Secretary Kennedy said he didn't hold private meetings with his CDC director in the almost month-long she was in office. He said that she is lying about a claim in an op-ed where she says that he asked her to pre-approve vaccine recommendations from a committee he just appointed. So, I mean, how do you even process that?
Yeah, so I wasn't in that meeting, but I can tell you I was part of discussions with some of the senior advisors to where I was concerned that they were developing recommendations before our scientists gave them the data and the evidence. And you should base recommendations on data and science and not ideology. And from what I saw, that's what was going to happen.
He was also asked about politicizing vaccine panels, and he said, I didn't politicize it. He claimed that he just eliminated conflicts of interest, that it had been full of people with conflicts of interest, that he got rid of that, and that he diversified the panel. What's your response?
I appreciated the evidence that Senator Cassidy submitted showing that the ACIP prior members had extremely low levels of conflict of interest. And I actually had worked with our team to post all the conflicts of interest for the past 20 years on the website to be transparent. The current ACIP members, I think it was really important to hear that many of them were witnesses for companies suing vaccine manufacturers. To me, that seems a conflict. If you are trying to get vaccines removed, you probably shouldn't be on a vaccine committee if you're getting funding to do things like that.
You have a new op-ed in the Washington Post where you list 3 questions that you have for Secretary Kennedy. Will America be healthier? Will America be prepared for the next pandemic or major health threat? Is this the gold standard of science and transparency, or are those just slogans? Do you think your questions are being answered today? And what is the one question you really hope senators really push him on?
So I think the questions are being asked. I don't think they're necessarily being answered. Are we going to be healthy again? He talks about just firing all of CDC. Well, firing the people that are implementing the prevention and have shown that we do have a life-saving, work that we're doing. is probably not the way to go. We are not more prepared, and I think the fact that he couldn't answer simple data questions shows that the secretary is not prepared. And when you talk about gold standard science, we have been trying to post the data, and when you look at the upcoming vaccine committee meeting, I don't believe the presentations are posted yet for the public. Dr. Monarez had wanted to do things like that with even more time in public comment, and she was stopped.
Quickly, if you will, what is the biggest challenge for the CDC right now that you think Secretary Kennedy should be focused on?
Yeah, so I think the secretary needs to listen to the experts. Maybe he should get a briefing or two and spend time at the CDC and learn more about the agency. I'm not sure who he's getting his information from, but the CDC has dedicated staff that are on the ground working with local communities all the time on these different health threats. The secretary actually needs to know what the agency does.
Dr. Deborah Howry, thank you so much for your time. We really appreciate it. Let's go back into the hearing. This is Senator Hassan, I believe,